Who is underinsured and why it's a problem? Brought to you by Whole Washington for universal healthcare in Washington State. Who is underinsured? The first way that you can be underinsured is that your out-of-pocket costs over the last year are 10% or more of household income, and this does not include premiums. The second way is your out-of-pocket costs over the last year are 5% plus. This is only for individuals under 200% of the federal poverty line, and it doesn't include premiums again, so this is just paying for the doctor, paying for medications. And the last way you can qualify is if your deductible is 5% or more of household income. How much of the population does this actually constitute? In this chart, the first category, the top one, is the people who have insurance all year round and it's good insurance. And that's about 55% of people. It used to be a higher percentage of people back when we had more uninsured, but since the Affordable Care Act, the percentage of people with good insurance has gone down. However, the percentage of people who are uninsured has also gone down. And we've created this problem of the underinsured, which you can see constitutes the 23% in the slightly darker green, and also I would argue the 12% of people who don't have insurance all year round, who have coverage gaps, they fall into a similar category here. So we're talking about a third of Americans. As of 2024 data, about 56% of people are insured all year round with good insurance, and the rest of the people, about 35%, are underinsured and about 9% are uninsured. So why are they underinsured? In 2024 data, 23% of those with health insurance were underinsured, another 12% had a coverage gap. Around 2/3 of those who were underinsured had their coverage through an employer. Underinsured people are more than twice as likely to forego care because of costs. And this is roughly the same percentage as uninsured. 44% of underinsured people said they carry medical debt, and this compares to 8% overall. So people who are underinsured carry a significant amount of our medical debt. Underinsured people are also less likely to get regular care, to follow up on doctor-recommended treatments or tests, to get flu shots, to get blood pressure or cholesterol checked, get cancer screenings, to fill prescriptions as commonly as they need to, and to get specialist care for their health issues. Underinsured people are less served by our medical system. So what's the cure for this? The cure is universal health care. And as the UN defines it, the key elements found in successful models or universal health care are everyone is eligible to enroll or automatically enrolled, a universal set of essential health benefits, uniform billing and reimbursement, significantly publicly funded, and not for profit. So here in Washington State, do we have anything like this? Not currently. In Washington State, the Washington Health Trust, which is a bill in both houses, would provide to all Washington State residents comprehensive coverage, including medical, dental, vision, hearing, mental health, and reproductive care. There would be no deductibles, no copays, no networks, no denials, no bills, and zero out-of-pocket spending. This would cure the problem of underinsurance by providing good insurance to all Washington State residents. Want to help universal healthcare succeed in Washington? Check us out at wholewashington.org.